Today, the U.S. Food and Drug Administration authorized booster shots of the COVID-19 vaccine from Pfizer for young adults 16 and 17. Public health officials have urged Americans to get additional shots on concerns about the new Omicron variant of the coronavirus. This emergency use authorization will allow 16 and 17-year-olds to receive their third shot at least 6 months after their second vaccine dose. Currently, all U.S. adults are eligible for booster shots of the 3 COVID-19 vaccines from Pfizer, Moderna, and Johnson & Johnson. This authorization comes a day after Pfizer released data suggesting that booster shots could be a key to protection against the concerning Omicron variant of the coronavirus. The Centers for Disease Control and Prevention have identified fewer than 100 cases of Omicron in our country so far, but they expect this number to increase in the next coming weeks and months. Meanwhile, Delta variant of the coronavirus still continues to dominate and has driven up infections. We are averaging about 120,000 new cases per day, and colder regions such as here in the Northeast, we are starting to see a concerning uptick of cases. On this and much more, earlier today we spoke with Dr. Rachna Kulkarni. Here is Dr. Kulkarni. About the biggest news coming in today, Doctor, the FDA has given emergency use authorization for the booster dose for 16 and 7-year-olds. Huge news. People are calling it a game changer. I'd like to know, how are you observing this news and how important do you think this step was for the FDA to take?
I think with the holiday season coming, we are all going to get together. This is the time for family gatherings, and having this authorization, this recommendation will be a huge safety net for all of us to get together. This has been a rough year and a half for us, and everyone wants to get together with their families, with their grandparents. Multiple generations will be coming together. So having these young adults getting boosted would be the great thing. And Aditi, at this point, getting a booster is the new definition of being fully vaccinated. So I would like all our viewers to know this, that if at this point, if you can get a booster because that's when you're fully vaccinated, because the immunity from previous vaccination has started waning off.
Right. Let's talk about what is happening in the country because it is kind of concerning, and we are in the Northeast, doctors, so we keep on hearing that we all have to be extra careful now with the winter season coming. We're at 49 million cases, actually more than that in the country right now. 792,000 deaths total in the nation. Currently, we are seeing 120,000 cases per day, all related to Delta mainly. Please explain to us, why is this happening right now? How concerned are you, and what do we need to do with this holiday season coming especially?
Great questions, because this should be a concern for all of us. As you said, the whole country, the entire nation is seeing a huge surge in the infections. New Jersey has reported a significant increase in all the cases, and most of the cases are because of the Delta variant. We should also see not just New Jersey, but let's focus on the entire Northeast because there are some very worrisome trends emerging. Let's look at New Hampshire and Vermont, and I'll tell you why I'm saying that. New Hampshire and Vermont have approximately 70% of their population vaccinated, just very similar to New Jersey. And from an infectious disease perspective, when we are tracking their trends, New Jersey usually tends to be about 2 weeks behind these states. And at this point, we are seeing a huge surge in COVID-19 cases, mostly because of the Delta variant in Vermont and New Hampshire. These states were at pretty low numbers in the first surge. Now they're seeing a huge surge, and their rates of hospitalizations are more than ever. So just to follow the trend that we have historically followed for a year and a half, I do think that we are going to see a big surge in the hospitalizations. And unfortunately, our death rates will climb. Good news is from our perspective, we now know how to take care of COVID 19 cases much better than we had before.